We're excited about this building. It's a 75,000 square foot building. It's double the size of the current space, and it's about a $50 million investment. So a significant investment into caring for patients within the community.
So having a diagnosis of cancer and going through cancer therapy is one of the most difficult things that any person is going to have to do. And so cancer care should be, number one, it's got to be good, right? And so we have a team of professionals that delivers high quality cancer care. These folks are devoted, their practices are focused on cancer care.
Since 1954, St. Tammany Health System has been privileged to serve the healthcare needs of St. Tammany Parish. Our mission, we are the heartbeat of our community, caring for each patient with excellence, compassion, and teamwork. I think this new center really embodies that commitment.
We have a very unique clinical ecosystem here on the North Shore that includes the contribution of skill sets from various physicians. Dr. Nathan Rainey comes to mind, who's a gastroenterologist practicing here in the North Shore area that has an advanced training and skill set in endoscopic ultrasound. And to be able to contribute that to not only the diagnosis and the treatment of cancer is really a unique aspect of how we do things here at St. Tammany.
You know, as a community physician, the most important job that I can do is serve the patients in our community to the best of my ability. St. Tammany has been a tremendous partner and also strives for that common goal of providing excellent patient care. And that's why I'm so excited about the Cancer Center. You know, having a diagnosis of cancer can be a big burden, and having to travel outside the city or outside the state just adds to that burden. So having a top-notch cancer center here in the community where patients can come and not have to travel will be a wonderful asset to the community.
But caring for patients in the community isn't about the physical building alone. It's really about the care teams that are within it. And so the size of this building is going to allow us to bring together all of the physicians, all of their specialties that are needed, their nursing teams that are needed, the therapists that are needed in order to meet the complete care of the patients. And so the exciting part about this building is not the building, but about the people and the care teams that are going to be within it.
One of the things that drew me to Ochsner several years ago was the reputation of its cancer program. And at that point, it was really some really very good practices. But over the last decade, we've expanded this to be a cancer program that's founded on multidisciplinary care following evidence-based guidelines. And this approach has put us in a position where our survival rates for every single disease are better than what you would see from national averages generated by the SEER database or other national databases.
To me, partnership means survival. Survival is really the continuum of care for a cancer patient who is really in need of service.
You know, I'm honored and thrilled to be a part of the new Cancer Center. I think with the leadership of our local hospital communities and with the motivation of our community physicians, I think we can all come together in a new facility and provide excellent patient care.
Our measure of success over time is not really going to be just the number of patients we treat, but it's going to be about better outcomes for our patients here in the community.